Hi, and welcome back to my channel. If you're new, my name is Tracy, and I'm a licensed clinical psychotherapist in private practice. And today's topic is a topic that comes up a lot in some Facebook groups that I follow for therapists, and it is about salaries of a psychotherapist. So I thought I would cover some key points about money. So about 10, 11 years ago, just before I got licensed, I was still working for a nonprofit organization with a clinical degree in clinical psychology. So I got my master's, and I was making just under $20 an hour. This is about 10 years ago, with a master's degree in clinical psychology. And those organizations, the nonprofits, they work you into the ground. I mean, 40 hours a week. I was working into the evenings because I was doing family therapy in clients' homes, and it was a lot of documentation, a lot of emotional labor, and all of that for $20 an hour. And then I got licensed, and to get licensed, you have to have so many hours of clinical supervision under your belt, and of course you have to pass the exam, which was very difficult, but what exam is not? So I passed the exam, and then I started to make more money, right? I went into a group private practice, and when you go into a group private practice, they often split like 60-40. The clinician gets like 60, and the group practice owner gets the remaining 40%. I did negotiate my salary towards the last 3 years, where I got a split of 68%, and that was a bit of an improvement. But then from there, I opened a private practice. And here is where you have the potential to make, much more money. So private pay, you can charge basically whatever you want, but your private pay rate should be higher than your highest insurance reimbursement when you're credentialed with insurance companies. And I'll get to that piece in a minute. So my self-pay rate is $150 per session. I do offer a slight reduced rate if the clients ask for it. Now, you might think $150 for just under an hour is a lot of money, and it is a lot of money. It's a lot of money. It's a lot of money. But my training and the just labor that I went through, all of the hours and hours of clinical supervision that I had to pay for, and I have specialties that I'm trained in: complex PTSD and dissociative disorders, which is a rare modality. It's very rare for someone to get trained in dissociative disorders, because if you're getting trained in dissociative disorders, you're working with some of the most complex PTSD cases. So majority of my cases are complex. So I definitely work for my money. So my self-pay rate is $150 on average, and then I contract with the insurance companies. So you have to apply for each insurance panel, and if they approve you, you submit your rate. Now, my rate for the insurance companies is $175 per hour. They don't pay me that. They take your rate, take it into consideration, see what's going on in your area, and then they give you a set rate. So it's usually under than the original rate that you submit. But it's still not bad. They can range anywhere from, I would say, I'm trying to think of my lowest. I can't tell you exactly, because that would be a violation of the insurance contract. So I can't tell you what each carrier pays me, but I can give you a ballpark. And it's anywhere from about $90 to, say, $145 per hour. So it's somewhere in that range. And that's what makes clinicians able to make a living. because we don't work 40 hours a week with all the emotional labor that goes into each session and all the documentation that goes with it after. On average, a full caseload is somewhere between 20 and 25 clients a week. Anything more than that is, I personally can't do it. I know some therapists that see 30 clients a week. That would be so incredibly draining. I've never done that, and I hopefully never will have to. So you can do the math with those numbers. Now, there are some therapists that their private pay rate is over $200. I'm always amazed by that they can pull in consistent clients who are willing to pay that. But there's so many factors that go into it. Location, if somebody's in private practice in Kentucky, they're not going to be making over $200 per session. That'll work for somebody who's working out of New York, possibly Massachusetts, because it's very expensive here. Definitely California. My consultant that I paid for hourly consultation, I think her rate is maybe $250 an hour, and she does very well. And it depends on your niche. So if you just treat typical anxiety, depression with, treatment modalities that are very, very common, like CBT and DBT, you're probably not going to make that high rate. But if you're trained, let's say in EMDR therapy, which I'm certified in EMDR therapy, somatic experiencing, IFS, those real powerful, effective, evidence-based treatments, you can definitely find clientele who are willing to pay top dollar for your service. So let me see if there's anything else I wanted to say about this. It's like we make a lot of money, or we can make a lot of money, but the overhead fees when you're in private practice, those add up. So we do have to ask for a higher rate to offset, because we have to make a profit, So this was behind the scenes, what it's like to set your rate, ballpark, what we can pull in. And it can be lucrative. It definitely can be profitable. But again, it's hard work. It's very, very hard work, very draining, definitely. And you need an awesome self-care regimen and wellness practices to stay afloat. Otherwise, like I said, you can sink. Okay, thanks for watching, and subscribe if you want to hear more videos from me and support my channel. Have a great day.